Hello, everyone. This is Dr. Jennifer Teal. Welcome back to my channel. This time around, we are going to discuss the root operations in the medical and surgical section of ICD-10-PCS. As you may recall, the root operation is reflected by the third character of your ICD-10-PCS code. What I have here in front of you is just one version of a code book. And as you can see, we are in Appendix B, root operation definitions. So take a look for this in your version of the code book. The table here is very handy because it lays out each of the root operations along with the definition, a general explanation, and some examples. Understanding the root operations is really the backbone of ICD-10-PCS. That's usually going to be your starting point when you're trying to look something up in the alphabetic index. Often it's going to be with that root operation that you're starting with. So it's critical that you have a good understanding of these root operations. What the root operation does is tell the story of the objective of the procedure. When they perform a certain kind of procedure, what is it that they're trying to accomplish by completing that procedure? What is the objective of the procedure? So let's take a look here. The first one we have is alteration. An alteration is used to modify the anatomic structure of a body part without affecting the function of a body part. So that's what they're trying to accomplish. That is the objective of the procedure. They're modifying the structure without affecting the function. So the explanation given in this one is to improve appearance. And that tells you that this is mostly going to be used for cosmetic purposes. No function, just appearance sake. So they give some examples: a breast lift, a breast augmentation, a facelift, a nose job, if it were strictly for cosmetic purposes. Now, if it were done for medical purposes, then it wouldn't be alteration, for example. So a nose job just for the sake of appearance would be alteration. But if there is like a broken bone or something like that they're actually fixing, then it becomes a different root operation. So again, what's the objective of the procedure? In this case, it is to improve the appearance, right? Appearance sake only. My recommendation as you're learning these root operations is to get you some index cards and write the term on one side, the definition on the other side, and start to study these root operations and really make sure that you understand the root operation. When the provider is writing the procedure note, they're not going to use the same terminology. So they're not going to call it an alteration. They're going to say what they actually did in their own medical terminology. So, they're going to say that it was a breast augmentation. And you have to know that breast augmentation equals alteration. So there are 31 different root operations in the medical and surgical section. Our next procedure is bypass. Definition: altering the route of passage of the contents of a tubular body part. That's the definition of bypass. The explanation: rerouting contents of a body part to a downstream area of the normal route to a similar route and body part, or to an abnormal route and dissimilar body part. It includes one or more anastomosis with or without the use of a device. So because it includes that anastomosis, that would be integral to the procedure and you would not code that separately. So a colostomy formation. If you think about what is the objective of that, it is to reroute the intestinal tract, right? So they're making an artificial opening to the outside, which reroutes it, however you want to pronounce it. So that would be bypass. What is the objective? To reroute the contents. When they do a coronary artery bypass, a cabbage, okay, they are rerouting the elements, right? So always think of what are they accomplishing with the procedure. They're rerouting, it's a bypass. Change, taking out or off a device from a body part. So if you don't have a device involved, then you're not at the right root operation. So change always uses a device. Taking out or off a device from a body part and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. So for change, because it says without cutting or puncturing, the approach is always going to be external. So that's a good tip for you. Whenever you're coding change, your operative approach is external. And they give you some examples: a urinary catheter change, a gastrostomy tube change. So they're just changing the device. They're doing it externally, no cutting or puncturing. Next, we have control, stopping or attempting to stop post-procedural or other acute bleeding. Examples: control of post-prostatectomy hemorrhage, control of intracranial subdural hemorrhage, control of bleeding duodenal ulcer, control of retroperitoneal hemorrhage. So the objective is to stop post-procedural or other acute bleeding. Creation, putting in or on biological or synthetic material to form a new body part that, to the extent possible, replicates the anatomic structure or function of an absent body part. So this is strictly used for gender reassignment surgery and corrective procedures in individuals with congenital anomalies. So they have to create a new body part, see? So creation of a vagina in a male, creation of right and left atrioventricular valve from a common atrioventricular valve. So that would be a congenital anomaly versus a gender reassignment. Destruction, physical eradication of all or a portion of a body part by direct use of energy, force, or a destructive agent. So none of the body part is physically taking out. It is physical eradication. So there's nothing left to remove. And that would be like a fulguration of a rectal polyp. Cautery. So anytime you've seen cautery, that is a destruction because there's nothing to remove, right? Detachment, cutting off all or a portion of the upper or lower extremities. So this one is very specific. Cutting off all or a portion of the upper or lower extremities. So this is an amputation procedure. The body part value is the site of the detachment, with a qualifier, if applicable, to further specify the level where the extremity was detached. So you're below the knee amputation, disarticulation of the shoulder. So again, a very specific root operation. Dilation, expanding an orifice or the lumen of a tubular body part. So this is going to be your percutaneous transluminal angioplasty, internal urethrotomy. So they're expanding it or making it larger. Division, cutting into a body part without drainage, without draining fluids or gases from the body part in order to separate or transect a body part. So a spinal cordotomy, osteotomy. Now, this is really one thing that I want to point out here is where your medical terminology is going to come in handy, because again, The provider is not going to say, I did a division, right? They're going to say, I performed a spinal cordotomy. And then you have to figure out what that means in terms of PCS when it comes to the root operation definitions. So this is where your terminology really comes in handy. So a division might be an otomy, because that is to cut into, right? Some of the other common terminology that you're going to be looking for when they say ectomy, for example, and we haven't gotten to these root operations yet, but an ectomy could be an excision, it could be a resection. So those prefixes and suffixes that you learned when you did your medical terminology, those are really going to come in handy here. So let's see, where were we here? So we did creation, destruction was fulguration, right? Cautery of a skin lesion, cautery of a polyp or a bleed. Detachment is going to be our amputations. Dilation is making something larger. Division, we've covered that one. So drainage, taking or letting out fluids and or gases from a body part. So they're draining a fluid or gas from a body part. Now with your drainage procedures and your excision procedures, when it comes to your qualifiers in the PCS tables, anytime they've done it for diagnostic purposes, then you're going to have a diagnostic qualifier. So when it's a biopsy, so they take a sample out so that they can send it to pathology to figure out what the diagnosis is. That's what we call diagnostic. So any biopsies will have the qualifier of diagnostic. So for drainage, they could send the fluid over to pathology for diagnostic purposes. If they took a biopsy or a sampling, so say they did a liver biopsy, or maybe they had a nodule that they biopsied or something like that. Anytime biopsy is used, it's going to be a diagnostic. That leads us next to excision, cutting out or off without replacement a portion of a body part. So I said ectomy, and ectomy means cutting out, but the difference is going to be whether it's a portion of the body part that was cut out or all of a body part that was cut out. And one caveat that I want to make here is when we talk about a body part, we're not talking about the body parts as you learned the major body parts in your anatomy class. What we're talking about here is if the body part has its own body part value in PCS and whether they took all of that versus some of that. So for example, I'm just going to hop over to any of the tables right quick so that we can get some ideas of what we mean by that body part. So your body part is your fourth character, and it doesn't really matter where I'm at in the book right now. This is just an example of one of the tables. So if they did an excision of the right lung versus the lower lung lobe left, you see how that lobe of the lung has its own body part value? If they took all of that lobe, it would be a resection, because even though the lobe is only part of the lung, it has its own body part value in PCS. So when you look at excision versus resection, the difference between those two root operations, one is part of a body part and one is all of a body part. And this is what we mean. Does it have its own body part value? And did they take all of that, or did they take some of that? So did they take all of the trachea or some of the trachea? Did they take all of the lower lobe, right lower lobe of the lung? Okay. Did they take all or some of the left upper lobe of the lung? So you have to pay attention to these body part values when you're applying that definition. Because again, we're talking about the definitions and terminology within PCS itself, not necessarily in your medical terminology, anatomy and physiology, and what the doctor wrote in the note. So that's a very important point. Continuing on, we have extirpation. Extirpation is taking or cutting out solid matter from a body part. So drainage was taking or letting out fluids and gases, and extirpation is solid matter from a body part. And it could be an abnormal byproduct of a biological function, or it could be a foreign body. It may be embedded in a body part or in the lumen of a tubular body part. So thrombectomy, okay, so a clot. When they remove a clot, that is going to be extirpation. So what is the objective of a thrombectomy? The objective is to take out solid matter, and that equals extirpation. So this is how you go about determining which root operation is appropriate. Coming over here to continue on the next page, we have up next, extraction. Extraction is pulling or stripping out or off all or a portion of a body part by the use of force. Dilation and curettage, a DNC, that's what they're doing. They are stripping out the lining, okay? So that's what a DNC would be. So that would be an extraction. A vein stripping is another example. And again, the qualifier diagnostic is going to be used for extractions that are biopsies. Fragmentation, that one is going to be similar to your extirpation, but the difference here is with fragmentation, they're breaking the solid matter into pieces. So think about kidney stones. If they used ultrasonic waves to break those into pieces before they remove them, that would be a fragmentation. So extracorporeal shockwave lithotripsy. So lithotripsies, that's going to be your fragmentations. They've broken them into pieces before. So it could be manual force, it could be ultrasonic force. That's fragmentation. And remember, when we talked about extirpation, it was taking out solid matter from a body part. And here it's solid matter, but it is breaking the solid matter into pieces. Fusion is our next root operation, and that is joining together portions of an articular, so that's a key right there, of an articular body part, rendering the articular body part immobile. So they're fusing it together so they no longer move separately. The body part is joined together by fixation device, bone graft, or other means. So this is going to be your arthrodesis, your spinal fusions. So that's going to be a fusion. Insertion, putting in a non-biological appliance that monitors, assists, performs, or prevents a physiological function, but does not physically take the place of a body part. So insertion of a radioactive implant, insertion of a central venous catheter. So a central venous catheter assists, performs, or prevents a physiological function, but does not physically take the place of the body part, right? It's an appliance, it's something extra, it's not replacing anything. Next, we have inspection, visually and or manually exploring a body part. Your inspection procedures, I want you to be a little bit careful about, because if you use your alphabetic index to look up the oscopies mean that a scope was used to visualize, but we always have to come back to what the objective of the procedure is. So when you're looking up something that is an oscopy, that oscopy or scopic, if they might say endoscopic, laparoscopic, so anything that uses a scope, yes, they're inspecting, but we have to ask ourselves, what is the objective of the procedure? Because it might simply be our operative approach that is reflected with that scope. Because if they do anything while they're in there, so maybe it is a laparoscopic biopsy, they actually removed something. So it's no longer just an inspection. So you have to really pay close attention to the objective of the procedure. Was the objective to simply visually explore, or was the objective to do something more definitive while they were in there? So your inspection procedures are going to be truly when they're simply looking around. A diagnostic arthroscopy. So they didn't do anything. They just went in there with an arthroscope into the knee joint and they looked around. They didn't find anything wrong. That makes it an inspection. If they do an arthroscopic drainage, so maybe there's fluid in that knee joint and they have to drain it, well, now it's no longer an inspection. So I hope that makes sense. You have to be careful with this inspection one. Next, we have map, and that is locating the route of passage of electrical impulses and or locating functional areas in a body part. The key here on this one is that it's applicable only to the cardiac conduction mechanism and the central nervous system. So your cardiac mapping or your cortical mapping. So this is one that's used only in a few instances, and it's a very specific procedure. We talked about dilation earlier, and now we have one that's occlusion. So with dilation, we were opening, and with occlusion, we're closing. So occlusion is completely, so not just narrowing it, but completely closing an orifice or lumen of a tubular body part. So this is only applicable to tubular body parts. The orifice can be a natural orifice or an artificially created orifice. So a tubal ligation is a good example of an occlusion. They completely close them off. Ligation of an inferior vena cava. Reattachment, putting back in or on all or a portion of a separated body part to its normal location. So they're reattaching it to where it belongs originally or other suitable location. Vascular circulation and nervous pathways may or may not be reestablished. So reattachment of a hand, reattachment of an avulsed kidney. So something that got separated that they are putting back. That's a reattachment. Release is freeing a body part from an abnormal physical constraint by cutting or by use of force. So some of the restraining tissue may be taken out, and that would be integral to the procedure. It's in order to accomplish the release, but none of the actual body part is taken out. So a carpal tunnel release is a good example. Adhesiolysis, so lysis of adhesions would be a release. It's to free, so adhesions, you might have had some kind of abdominal surgery in the past, and the scarring creates adhesions, and maybe a particular body part is restrained now. It's got adhesions to the abdominal wall, and they need to go in and do lysis of adhesions. That would be a release. Removal, taking out or off a device. So again, we have this one has to have a device. So they remove a device from a body part. If a device is taken out and a similar device put in without cutting or puncturing the skin or mucous membrane, the procedure is coded to the root operation. Change, remember we covered change already. So change is when you swap them, you're swapping them out. Removal is when you're completely taking it out and you are not replacing it. So a drainage tube removal, removal of a cardiac pacemaker. So it has to involve a device that is being removed from a body part. No replacement, you're just taking it out. Repair is restoring to the extent possible a body part to its normal anatomic structure and function. This is used only when the method to accomplish the repair is not any other root operation. So they didn't do it by a release, they didn't do it by, some other root operation. If none of the other root operations apply to the repair, then that's when you're going to use this repair. Sutures is a good example. If they have to do some kind of sutures, then repair is the only applicable root operation. When they do a colostomy takedown, so essentially what that means is the colostomy is going to be removed and they're going to suture them back up. So they're repairing that opening. So that external stoma that they made, they're repairing that by the use by using sutures. So it's only used when no other root operation is used to accomplish the repair. Replacement, putting in or on biological or synthetic material that physically takes the place or function of all or a portion of a body part. So the body part may have been taken out or replaced, or may be taken out, physically eradicated, or rendered non-functioning during the replacement. A removal procedure is coded for taking out the device used in a previous replacement procedure. So replacement, a total hip replacement. They're replacing that hip joint with artificial means, right? So a total hip replacement. A bone graft, free skin graft. So they're replacing all or a portion of a body part. Reposition, moving to its normal location or other suitable location, all or a portion of a body part. The body part is moved to a new location from an abnormal location or from a normal location where it's not functioning properly. The body part may or may not be cut out or off to be moved to the new location. So here's an example, reposition of an undescended testicle. So they're too high, they have to bring them to the correct location. That would be a reposition. If they have to reduce a fracture, so a fracture reduction is a reposition. Resection, cutting out or off without replacement, all of a body part. So this is the one that I mentioned earlier, was very similar to excision. And the difference is whether it's part of a body part or all of a body part. And remember, it's body part as defined by PCS. So they might use that ectomy suffix in the op note, but you have to read the details of the note to see if they took out all or some, so that you know if it's a resection or if it's an excision. So a total nephrectomy. So if they took out the entire kidney, it would be resection. If they did a kidney biopsy, it would be an excision. And remember that table that I was showing you, there were separate lobes of the lung that were their own body parts. So a lobectomy, where they take the entire lobe, would be considered a resection, even though they're not removing the entire lung, because lobectomy, because the lobe has its own body part, that makes it a resection. So you have to look at the body part values for some of these just to make sure. Now, restriction is partially closing an orifice or the lumen of a tubular body part. So we had dilation, we had occlusion, and now we have restriction that all deal with opening and closing the lumen of a tubular body part. This is just partially closing, whereas occlusion, you can see occlusion is completely closing. So that's the difference. You're going to have to look at the procedure and see, did they completely close it off or did they just partially close it off? So a fundoplication, a cervical cerclage, these are your examples of restriction where they're just partially closing it or narrowing it. Okie dokie. So what else do we have here? Next, we have revision, and that's a correction. So something that you revise. So some of these words, if you think about the meaning of the word, it will help you understand the root operation. So revision, to revise something, right? So you're correcting something to the extent possible, a portion of a malfunctioning device or the position of a displaced device. So revision is another root operation where it always involves a device. So you can't just have a revision of a body part. It has to be a device. So they have adjustment of the position of a pacemaker lead, re-cementing of a hip prosthesis. So they're correcting to the extent possible a portion that's malfunctioning or the position of the device. Supplement is, if you think about it, what does supplement do? It aids, it puts in or on a biological or synthetic material that reinforces or augments, it adds to the function of a portion of a body part. That biological material is non-living, or it can be living and from the same individual. The body part may have been previously replaced, and the supplement procedure is performed to physically reinforce or augment the function of the replaced body part. So a herniorrhaphy using mesh. So it's a hernia repair, and the mesh is used to reinforce it. A mitral valve ring annuloplasty, put in a new acetabular liner in a previous hip replacement, so supplement. Next, we have transfer, moving without taking out all or a portion of a body part to another location to take over the function of all or a portion of a body part. So the body part transferred remains connected to its vascular and nervous supply. So they don't physically cut it out completely. It stays connected to its vascular and nervous supply. So these are your transfer graphs. They still are connected and they're just moving it to another location. So tendon transfer, skin pedicle flap transfer, those are some examples there. And the last one for medical and surgical, and I'm not going to go into the other sections today, I'm focusing just on med surg. So we have transplantation as our final one, putting in or on all or a portion of a living body part taken from another individual or animal to physically take the place and or function of all or a portion of a similar body part. I think transplantation is pretty clear and pretty straightforward. Obviously, some body part or organ has been replaced, and it could have been replaced. It could be a zooplasty, it could be, so it could be an animal, or it could be another human, right? So a kidney transplant, a heart transplant, any kind of a transplant, and transplants are going to be pretty obvious. Now, with this particular version of the code book and many others, I'm sure, there's this other table, other appendix, I should say, that has these root operations now grouped. And this might be an easier way for you to learn them because it puts them into buckets. So similar types of procedures are in these buckets, and it helps you kind of get to know them as a grouping. So procedures that take out some or all of a body part. So if you know the objective of your procedure is to take out some or all of a body part, you can come here and know that you would only be dealing with one of these. If they're taking out some or all of a body part, it has to be a destruction, a detachment, an excision, an extraction, or a resection. So it really helps you narrow down your field when you're trying to figure out what was done. So if the objective is to take out some or all of a body part, it's going to be one of these. So you have the objective of the procedure. Destruction is eradicating. Detachment is cutting out or off without replacement. But remember, extremity only. So this is your amputations. Your excision, cutting out or off without replacement. So you see that you have 3 here that are cutting out or off without replacement. So when you have something like that done, you have to come over here and say, okay, extremity only. Nope, it wasn't an extremity. Therefore, it's not detachment. Okay, so what 2 are left? I have excision, I have resection. The difference, some of a body part versus all of a body part. So a lumpectomy versus a mastectomy. A lumpectomy, they take a lump out of the breast, whereas a mastectomy, they remove the entire breast. So there's your comparison. So that's what this appendix does here. It groups them together. Okay, so you have procedures that take some or all of a body part, procedures that put in or put back or move some or all of a body part, procedures that take out or eliminate solid matter, fluids, or gases from a body part, drainage, extirpation, fragmentation. Procedures that involve only examination of the body parts or regions, inspection and mapping. Procedures that alter the diameter or root of a tubular body part. So all of these, we're talking about tubular body parts, and they're altering the diameter or the root. So we talked about dilation versus occlusion versus restriction. So those ones either partially closing, completely closing, or expanding. And then bypass is rerouting. So that's the difference, but all tubular body parts. And then you can see the examples here. The procedures that always involve a device. So we talked about some of those where I showed you in the definition, it said you must have a device, you must have a device, right? So procedures, pardon me, let me scroll down a little bit here. Procedures that always involve devices: change, insertion, removal, replacement, revision, supplement. So if a device is not involved, you should not be using any of these root operations. And then here we have your examples: gastrostomy, tube change, central line insertion, central line removal. So insertion, removal, a total hip replacement, a revision of a pacemaker, abdominal wall herniorrhaphy using mesh. So the mesh is the supplement. Next, we have procedures involving cutting or separation only, division and release. Procedures that define other repairs, control and repair. Procedures that define other objectives, so not one of the above. So we've got alteration, creation, and fusion. Those are the 31 root operations that make up the medical and surgical section. Again, I suggest creating flashcards to help you study these, just to give you some more details on how important it is for you to understand not only the words that are being used, so your medical terminology, where it was performed, so your anatomy, but also sometimes you might have to go out there on the internet and you might have to look at a procedure and really understand how a particular procedure is performed in order for you to break it down into the right pieces you need to build your PCS code. So just because they said they did X, Y, and Z, what does that truly mean? How is that procedure accomplished? And sometimes your terminology is a good, it's a good first step, and it will help you maybe narrow down the field a little bit, but it's not going to completely tell you. And that ectomy was a good example. Ectomy lets you know that they cut something out, but we don't know if it was all or some. So we have to investigate a little bit further. Lysis is usually going to be a release procedure. So when you have that suffix lysis, That's a good indicator that a release was performed. Your oscopies, again, that's going to be an inspection, but you have to use care, because if they did more than simply inspect, now we need to look for the more definitive procedure and code it that way. Your otomy is just to cut into. So all we know is they cut into something. So what was the objective? Was the objective a division? Was the objective a drainage? Just some things to look for. So if they say that they did an amputation, that one's going to be pretty straightforward. That's going to let you know they did a detachment. Anastomosis, that tells you they did a bypass. Angioplasty, we don't know what they did there. Could have been a dilation, could have been a repair, could have been a replacement, could have been a supplement. So sometimes the word itself, you have to dig deeper, because again, the clinical staff is going to use the terminology that they're accustomed to using in their profession, right? So how they learned it. And they're going to describe, so they're going to use that term. They're going to say that they did an appendectomy, but then you have to read the details of the note to see, is it an excision or is it a resection? And you can't go by the fact that they said such and such was excised, because again, you got to look at, was all of it excised, cut out, or was some of it? They might say they resected such and such. Well, you have to make sure it was all of the body part before you land on resection, because if it was only some of the body part, then it's going to be excision. So these are some good examples for you. So let's see, let me give you a couple more examples here. We have I don't want to go outside of the med surg section. So like a bunionectomy is going to be an excision. They're removing a bunion off of a body part. Anything orify is often going to be a repair. But again, look at the details, okay? Carpal tunnel repair is going to be a release. A C-section is going to be an extraction because they are pulling out. A cauterization could be a destruction or it could be a repair. A colostomy could be a bypass or it could be a drainage. A craniotomy, that just means they cut into. So what did they do when they got there? Did they do a drainage? Did they do a division? You have to investigate. So I hope that's your key takeaway here with this presentation, is that understanding the definitions is the first step, and then understanding the actual procedure as described in the procedure note is the next piece, because you have to be able to parse out the little details from the note in order to know whether the definition applies. And that's the other key, is that the full definition must apply in order for you to use a particular operative approach. The last hint that I'm going to give you before I leave you today is that when you're in your book and you're building your codes, I want to remind you that when you're in the tables, your top three, the top left of your table is always your first three characters. You see, your first three characters is always here. And your root operation is your third character. The book always gives you the definition and explanation. So use this as a way to check your work, to make sure you're in the right area, in the right root operation. You're going to come here and say, oh, dilation, expanding an orifice or the lumen of a tubular body part. Is that really what the objective of my procedure was? And if it was not, then you need to start over and go back to the drawing board. And it gives you an explanation, which is always helpful. So this is a nice tool for you while you're in the tables of your code book. So I hope you found that helpful. And if you enjoyed this video, please like and subscribe to my channel. I hope to produce more content that will help you become familiar with ICD-10-PCS coding And with that, I am going to leave you for the day. Dr. Teal out.